Hi, and welcome to our channel where we bring you important health information to help you live your best life. Today, we're talking about something that affects millions of people, diabetes, and how it can impact your eyes. Did you know that diabetes is a major cause of blindness in adults and can also lead to vision problems in children? But here's the good news. There are powerful ways to protect your vision and prevent diabetic eye disease. Stay tuned as we guide you through essential steps to keep your eyes healthy. Whether you've had diabetes for years, were just diagnosed, or simply want to know how to protect your vision, this video will guide you through essential steps. In this video, we'll break down what diabetic eye disease is, how diabetes can affect your vision, and most importantly, the steps you can take to keep your eyes healthy. By the end of this video, you'll have a clear roadmap to prevent vision loss and maintain healthy eyes for years to come. But first, let's start with the basics. What's diabetes? Diabetes is a chronic condition marked by persistently high blood sugar levels, known as hyperglycemia, due to the body's inability to produce or effectively use insulin. Understanding diabetes and its types. Before diving deeper into how diabetes affects your eyes, it's important to understand what diabetes actually is and that there's more than one type. Most people are familiar with diabetes mellitus, but did you know there's another type called diabetes insipidus? Let's break it down. Diabetes mellitus. This is the type of diabetes we most commonly discuss. It comes in two main forms, type 1 and type 2. Type 1 diabetes. This is the diabetes that occurs when the body's immune system mistakenly attacks and damages the beta cells in the islets of Langerhans found in the pancreas. These beta cells are responsible for producing insulin, a hormone that helps regulate blood sugar levels. As a result, people with type 1 diabetes must receive insulin from external sources to help move glucose from the bloodstream into cells where it can be used for energy. Type 1 has a sudden onset, often occurs in children, with weight loss and a risk of diabetic ketoacidosis, DKA, which is a dangerous condition where the body starts breaking down fat for energy, producing toxic ketones. Type 2 diabetes. This is more common and happens when the body either does not produce enough insulin or cannot use it effectively, a condition called insulin resistance. It typically develops gradually, usually in adults, and is often associated with weight gain and lifestyle factors. Diabetes mellitus, whether type 1 or type 2, share symptoms like frequent urination, excessive thirst, fatigue, blurred vision, and high blood sugar levels, which over time may damage various organs, including the eyes. Next, diabetes insipidus. This condition is entirely different from the more well-known diabetes mellitus and is unrelated to blood sugar levels. Instead, it affects how your kidneys manage water. Diabetes insipidus occurs when the body doesn't produce enough antidiuretic hormone, ADH, from the posterior pituitary gland, or when the kidneys don't respond to ADH properly, leading to excessive thirst and frequent urination. While it doesn't typically cause complications like eye problems associated with diabetes mellitus, it's important to recognize the symptoms. If you experience extreme thirst, polydipsia, and frequent urination, called polyuria unrelated to blood sugar levels, consult your doctor to rule out diabetes insipidus or other underlying causes. How diabetes affects your eyes. Now that we've covered the different types of diabetes, let's focus on how diabetes can affect your eyes, specifically diabetes mellitus. When we talk about diabetic eye disease, we're really talking about a group of conditions that can affect people with diabetes. People with diabetes are at risk for several eye conditions. The most common diabetic eye disease is diabetic retinopathy, which occurs when high blood sugar damages the blood vessels in the retina, the part of your eye that helps you see. This damage can lead to vision problems and, if left untreated, potentially cause vision loss. Imagine your eye as a camera and the retina is like the film. If the film is damaged, your photos or your vision will be blurry or distorted. So over time, if the damage becomes severe, it can lead to blindness. Number 2, developing cataract. But it's not just about retinopathy. Diabetes can also increase your risk of developing cataracts, which cloud your vision. This happens as diabetes causes excess sugar to accumulate in the lens of the eye, where it is converted to sorbitol, leading to lens swelling, opacity, and eventually clouding of vision. Number 3, developing glaucoma. Glaucoma is a condition that damages the eye optic nerve. In people with diabetes, the risk of glaucoma may increase due to damage to the blood vessels in the front of the eye. This damage can block the drainage of fluid, leading to increased eye pressure and subsequent optic nerve damage. So with so many risks, it's clear that taking care of your eyes should be a top priority if you have diabetes. Now that we understand the risks, let's talk about prevention. The great news is that by managing your diabetes carefully, you can significantly reduce your chances of developing these eye problems. Prevention starts with controlling 3 key factors: blood sugar, blood pressure, and cholesterol. Let's break it down. Imagine your eye health as a 3-legged stool. If one of these legs, your blood sugar, blood pressure, or cholesterol, gets too high, the stool starts to wobble. But if you keep all the 3 balanced, your eye health remains stable and strong. For example, let's say you maintain your blood sugar levels within the recommended range. Over the course of a year, you could reduce your risk of retinopathy by up to 76%. That's a huge difference just by keeping your blood sugar in check. One of the most important steps in preventing diabetic eye disease is scheduling regular eye exams. Even if your vision seems perfectly fine, diabetic eye problems can develop without any noticeable symptoms at first. A fundus eye exam allows your eye doctor to closely examine the back of your eye, checking for any signs of damage. Think of it like taking your car in for regular maintenance. You might not see any issues on the surface, but catching a problem early can save you from bigger trouble down the road. And here's a practical tip. People with diabetes should have a fundus eye exam at least once a year. More frequent visits may be necessary, depending on your eye health and how well your diabetes is controlled. So, managing these 3 key health targets, blood sugar levels, blood pressure, and cholesterol, is crucial for protecting your vision and well-being. Maintaining their proper levels as listed below can significantly reduce your risk of diabetic eye diseases like the retinopathy, glaucoma, and cataracts. Number 1. Fasting blood sugar below 100 milligrams per deciliter or 5.6 millimoles per liter. Number 2. Blood pressure under 120 over 80 millimeters of mercury. Number 3. Cholesterol, low density lipoprotein, LDL, known as bad cholesterol, below 100 milligrams per deciliter or 2.6 millimoles per liter, and total cholesterol below 200 milligrams per deciliter or 5.2 millimoles per liter. By keeping these factors in check, you're not only safeguarding your eyes but also improving your overall health. Now, let's talk about something that's in your control every single day: your diet and lifestyle. The food you eat doesn't just affect your waistline, it also plays a key role in protecting your eyes. Foods rich in antioxidants like leafy greens and omega-3 fatty acids found in fish are great for your eye health. For instance, studies have shown that omega-3s can reduce the risk of diabetic retinopathy by 30%. And it's as simple as adding a few servings of salmon or walnuts to your weekly meals. Staying active is also essential. Regular exercise not only helps keep your blood sugar levels in check, but it also improves circulation, which is crucial for maintaining healthy eyes. Aim for at least 30 minutes of moderate activity most days of the week. Let's move on to some practical tips for protecting your eyes every day. Here are a few simple but effective ways to take care of your vision. Number 1, quit smoking. If you smoke, now is the time to quit. Smoking can accelerate damage to your eyes, especially if you have diabetes. Number 2, wear sunglasses. UV rays can harm your eyes over time. Wearing sunglasses or photochromic anti-reflective lenses that block 100% of UV rays protects your eyes from damage, reducing your risk of cataracts and other complications. And number 3, rest your eyes. We live in a world of screens. Whether you're working on a computer or scrolling through your phone, it's important to give your eyes a break. Use the 20-20-20 rule. Every 20 minutes, look at something 20 feet away for at least 20 seconds. This reduces eye strain and keeps your eyes refreshed. By incorporating these simple habits into your daily routine, you're taking powerful steps to protect your eyes and prevent diabetic complications. Remember, small changes can make a big difference when it comes to your vision. Let's recap what we've covered today. We started with an understanding of the different types of diabetes, including how diabetes mellitus can impact your eyes. We discussed the most common diabetic eye diseases and how they develop. But more importantly, we highlighted the steps you can take to prevent them. If you take away one key message from this video, let it be this: managing your diabetes and being proactive about your eye health can prevent serious complications down the line. Whether it's through regular eye exams, a healthy diet, or making lifestyle changes, you have the power to protect your vision. Remember, your eyes are a window to your overall health. Take care of them and they'll take care of you. Thanks for watching. If you found this video helpful, don't forget to give it a thumbs up and share it with anyone who might benefit from this information. Subscribe to our channel for more upscale health tips, and as always, stay informed and stay healthy.